Hi there, it's Dr. Yumna Riaz, and today our topic of discussion is respiratory distress syndrome. So, preterm infants may suffer from respiratory distress syndrome because their surfactant production is not yet completed. You know that surfactant is involved in aerating the alveoli, and when surfactant production will not be completed, then the alveoli will be collapsed. The infant is dyspneic, and the history of antenatal steroids to the mother is very important because steroids contribute to the fetal lung development in the utero. Clinical features. They include nasal flaring, grunting, intercostal recessions, respiratory rate greater than 60 breaths per minute. You may have noticed that the clinical features are same as TTN that we discussed in the previous video. So the difference comes in the chest X-ray. Here the chest X-ray include bilateral granular opacities. You can see that the opacities are more coarse, and in TTN the opacities are perihilar. Treatment. Treatment include assisted ventilation, that is oxygen, CPAP, or exogenous surfactant therapy. In TTN, the treatment was benign, self-limiting condition and it resolved in 48 hours. But here you have to give the treatment and the child is more sick as compared to TTN. So this is about RDS, and other DDs of the RDS include meconium aspiration syndrome, neonatal pneumonia, and TTN. So thank you so much. Like, subscribe, share, and have a good day. Thank you.